Steve here has kindly volunteered to be our patient today, and we're going to start off just with the general screening exam that he would need to do. And a lot of the examination is achieved while you're introducing yourself to the patient and coming into the room. You'd watch their gait pattern because problems in the upper extremity may affect the way a patient walks. They may not be able to use a cane if they have a limp, but they can't use a cane or a walker, for example. Or if they have a tremendously painful shoulder or elbow, it may affect their gait pattern. Certainly their standing posture and sitting posture will be affected, and it's important just to observe those things. It'll tell you sometimes a lot more than specific physical exam maneuvers will do. And then you take a general look for deformities, evidence of old fractures, dislocated joints, bony prominences. Muscle wasting is a very prominent thing to notice with certain conditions. For example, a patient with a rotator cuff injury will have some muscle wasting if they're supraspinatus and infraspinatus, and that's something that you should definitely be looking for in your general survey. These are things that you can notice easily without having to do a lot of detailed testing. When you shake the patient's hand, you can notice their grip strength and whether they have any tremors. And having done that, we will now move into a more specific part of the screening exam. If a patient has no functional complaints or symptoms, it's not usually necessary to test passive motion as well as active motion and stress all the joints. So what I would have Steve do is just elevate both arms right up over his head, try to bring them up against his ears, and then to bring his thumbs down the back of his spine, trying to hit T1 if he can. And this tells us that he's got full, unimpeded elevation, abduction of the shoulders. There's no rhythm problem with shoulder movement, and that he's got excellent rotation of the shoulder, getting his shoulders externally rotated and elbows flexed to reach the top of the spine. Then he'll bring his arms down and put his thumbs behind his back and try to reach up to T8 or T9. And again, this shows that he's got full adduction and internal rotation of both shoulders. We've already inferred some information about the elbow, but we're going to look more specifically now and have him extend his arms palm up so that we can see that there's full extension of the elbows and normal muscle bulk everywhere in the extremity. Full flexion now demonstrates that he's got good range of motion in the elbow and good function of those muscle groups. And then it's important to check pronation and supination. So with the elbows at 90 degrees and against the side, he's now in the fully supinated position. We flip over to full pronation, and that's normal as well. Then we can check for wrist extension, wrist flexion, radial deviation, and ulnar deviation, and that tells us that his wrist motion is good. You can also see that he's got full function of all of his extensor tendons here. The fingers are all and wrist are nicely extended, and finally we have him make a full grip, and that demonstrates that there's intact flexor function and full range of motion in the small joints. And finish off by doing some simple strength testing. I'll have him grab 2 fingers and squeeze hard to demonstrate grip strength, and then check elbow flexion to evaluate the major upper arm motor groups with resisted elbow flexion like this. It's then possible to finish off with some basic light touch sensory testing if there are any symptoms at all in that area. However, in a completely asymptomatic person, detailed sensory testing is unlikely to be positive. At this point, the screening exam is finished, and I'd either move on to some other part of the physical exam, or if there were directed symptoms or something that has shown up during the screening, then we'd move to a more focused part of the physical on the shoulder or the elbow or whatever pertains to their history or screening findings.